Dr. Mamta is going to deliver her opinion
जरा गाणी बंद करताय.
as per Ayurveda.
हो चालू झाली की आता.
कम्प्युटर डिपार्टमेंट, जे एक्स्ट्रा लोक आहेत ज्यांचं प्रेझेंटेशन नाहीये त्यांना म्यूट करा प्लीज. मानसी, Dr. Mamta is muted. Dr. Mansi, please unmute yourself.
Yes. Is my slide visible?
Yeah.
Oh, sir.
Please go ahead.
Good afternoon, everyone. Respected dignitaries, I am Dr. Mamta Adhav, Professor PG Guide from Department of Agatantra, Ayurveda Toxicology, भाऊसाहेब मोक आयुर्वेद महाविद्यालय नंदन नागपुर. तो मुझे जो टॉपिक दिया है कि कॉन्टैक्ट डर्मेटाइटिस के ऊपर इलेबोरेट करना है या व्यूज देना है. कॉन्टैक्ट डर्मेटाइटिस आयुर्वेदा व्यू. तो सबसे पहले तो हम डर्मेटाइटिस का मतलब स्किन डिसीजेस देखने के पहले थोड़ा सा स्वस्थ व्यक्ति के बारे में देखेंगे कि आयुर्वेदा में स्वास्थ्य या स्वस्थ व्यक्ति किसे बोला है. स्वस्थ पर्सन तो समादोषः समाग्निष्ट, मतलब जिसके हमारा जो आयुर्वेद है वो 3 मेन दोषास के ऊपर कंसेप्ट है. वात पित्त कफ 3 दोष जब ये सम प्रमाण में रहते हैं, बैलेंस में रहते हैं, तो व्यक्ति हेल्दी रहता है. और उसका अग्नि मतलब डाइजेस्टिव सिस्टम अगर प्रॉपर है, समधातु रसरक्त ये जो 7 धातु है बैलेंस्ड है. मलक्रिया मतलब उसका प्रॉपर फॉर्मेशन है, एक्सक्रेशन हो रहा है मलाज का, जैसे स्वेद मूत्र और पुरुष मतलब स्वेद. और प्रसन्न आत्मा इंद्रिय मन मतलब उसका माइंड और उसका स्पिरिचुअल हेल्थ अगर प्रॉपर है तो उस व्यक्ति को स्वस्थ इस प्रकार से आयुर्वेदा में बोला गया है. और जब इस प्रकार का ये तीनों मतलब दोष अग्नि धातु और मल क्रिया इनका बैलेंस बिगड़ जाता है, इम्बैलेंस हो जाते हैं, तो तब रोग की उत्पत्ति होती है. इस प्रकार से आयुर्वेदा में बताया गया है. आयुर्वेदोक्त जो संहिताएं है बृहत्रयी मतलब चरक संहिता, सुश्रुत संहिता और अष्टांग हृदय, एंड लघुत्रयी माधव निदान भाव प्रकाश और षाडंग संहिता इसमें सूक्ष्म तरीके से सुस्पष्ट तरीके से और विस्तृत हमें इस स्किन डिसीजेस का मतलब स्किन डिसीजेस को आयुर्वेदा में कुष्ठ रोग कहा गया है. एक्चुअली हम कुष्ठ रोग मतलब लेप्रेसी को कहते हैं, लेकिन आयुर्वेदा में स्किन डिसीजेस को स्किन डिसऑर्डर्स को कुष्ठ बोला गया है. निदान मतलब पॉजिटिव फैक्टर्स में हम इसका देखते हैं कि आहार निदान, विहार निदान पॉजिटिव फैक्टर और स्पर्श निदान जिसके कारण कॉन्टैक्ट रिलेटेड कॉजेस होते हैं, डिसीजेस होते हैं. आहार में हम देखते हैं कि अगर कोई व्यक्ति कर्ड मतलब अभिसंधी पदार्थ ज्यादा खाता है, चीज ज्यादा खाता है, ऑयली फूड ज्यादा खाता है, गुरु या स्निग्ध आहार ज्यादा, हाईली प्रोटीनस डाइट, हाईली फैटी डाइट ज्यादा खाता है, ज्यादा अम्ल रस का या कटु लवण रस मतलब ज्यादा नमक जन्य पदार्थ स्पाइसी और सॉल्टी फूड का ज्यादा मतलब सेवन करते हैं, या मिल्क एंड फिश जिसको हमारे इस आयुर्वेद में विरुद्ध आहार कहा गया है. तो विरुद्ध आहार का बार बार सेवन करते हैं. जैसे समोसा खा रहा है, एकदम गरम समोसा खा रहा है और उसके साथ एकदम आइसक्रीम कोल्ड आइसक्रीम खा रहे हैं, चाय के साथ नमकीन पदार्थ खा रहे हैं. तो इस प्रकार से अगर यह विरुद्ध आहार विहार इसी को आयुर्वेद में गर्भ विषाक्तता भी कहा गया है. तो इस प्रकार से इसका सेवन बार बार 1 दिन 2 दिन नहीं लेकिन ज्यादा दिन तक ज्यादा सालों तक बार बार इस प्रकार से विरुद्ध आहार का सेवन करते हैं तो लीड्स टू क्रॉनिक इन्फ्लामेटरी स्किन डिसीजेस. विहार निदान में बोला गया है कि देवा स्वाप अगर कोई व्यक्ति दिन में सोता है, आयुर्वेदा में दिन में सोना यह वर्ज्य बताया गया है, या अति स्नान बार बार स्नान करता है, ज्यादा उष्ण जल से स्नान करता है, तो ये क्या करता है कि स्किन बैरियर डिस्टर्बन क्रिएट करता है. स्पर्श निदान में जैसे रात्रि में जागरण कर रहा है, आयुर्वेदा में रात्रि में जागरण निषेध बताया गया है. प्रॉपर स्लीप जो है होनी चाहिए और स्ट्रेसफुल उसका लाइफ है, तो ये भी कुष्ठ रोग मतलब स्किन डिसीजेस होने में कारणीभूत होते हैं। और थर्ड जो मेन है वो स्पर्श निदान, जो हमारे पेशेंट में हमको दिखा था कॉन्टैक्ट रिलेटेड कॉजेस, जैसे असात्म्य स्पर्श। कुछ चीजें है कि कोई पर्सन को सात्म्य होती है, जैसे सरसप ऑयल, मस्टर्ड ऑयल है, उसकी मालिश अगर किसी पेशेंट को हम करते हैं तो किसी को सहन होता है, सात्म्य होता है, लेकिन दूसरे पर्सन को सात्म्य नहीं होता है, उसको इरिटेशन होता है, उसको बोलते हैं असात्म्य स्पर्श। तो इन सब कारणों से कॉन्ट्रैक्ट डर्मेटाइटिस जो है हो सकता है। संप्राप्ति मतलब पैथोजेनेसिस में हम बोलेंगे कि अगर कोई व्यक्ति इस प्रकार से विरुद्ध आहार विहार करता है तो उसकी डाइजेस्टिव सिस्टम जो है वो वीक हो जाती है, उसको अग्निमांद्य हो जाता है, और जिससे कि आमरस का फॉर्मेशन होता है। आमरस मतलब अपक्व आहार रस, जिसके कारण क्या होता है, ये अपक्व आहार रस क्या होता है कि ये दोषों को, पित्त वात दोषों को वायलेट करता है, अपने स्थान से उसका संशय करता है, और रक्त दुष्ट जो है रक्त के साथ ये मिक्स होता है, दुष्ट हुए ये जो वात दोष है वो रक्त दुष्ट के साथ मिलकर एक जगह जाकर कोई स्किन में लोकलाइज हो जाते हैं, उसको बोलते हैं स्थान संशय। हमारे इसमें संप्राप्ति इस प्रकार से बोलते हैं कि दोष दुष्ट एकत्रित होकर एक जगह स्थान संशय लेते हैं, और जिस जगह पे स्थान संशय होता है, जैसे त्वचा में अगर स्थान संशय होता है, लोकलाइजेशन होता है, तो उसका मैनिफेस्टेशन स्किन पे दिखता है, इचिंग, रेडनेस, वेसिकल डिस्चार्ज। तो इसी प्रकार से संप्राप्ति होकर, पैथोजेनेसिस होकर त्वचा विकार या कुष्ठ रोग की मतलब स्किन डिसीजेस की उत्पत्ति होती है। इसी को हमारे अगत तंत्र में, आयुर्वेदा टॉक्सिकोलॉजी में दूषी विष भी कहा गया है। दिस रिजेंबल्स विद दूषी विष कंसेप्ट वेयर लो ग्रेड टॉक्सिन्स, मतलब लो ग्रेड टॉक्सिन जो है धीरे धीरे शरीर में एक्यूमुलेट होकर ग्रेजुअली शरीर में इस प्रकार से स्किन डिसीजेज जो है वो प्रोड्यूस करते हैं। जो हमारा पेशेंट आया था उसको हमने ऑक्यूपेशनल एलर्जिक कॉन्ट्रैक्ट डर्मेटाइटिस डायग्नोस किया था, तो उसी को आयुर्वेदा में दूषी विष जन्य त्वचा विकार भी कहा जाता है, जो कि रिपीटेड कॉन्टैक्ट विद इरिटेंट और एलर्जिक सब्सटेंसेस वर्क प्लेस में होने के कारण होता है। इसमें पर्टिकुलरली जो पित्त दोष अगर होता है उत्क्लेशित, तो रेडनेस, बर्निंग सेंसेशन, इस प्रकार से सिम्टम्स दिखते हैं। कफ दोष के कारण अगर स्किन डिसीज हो रहे हैं तो ओजिंग, इचिंग और थिकनेस दिखता है। वात दोष के कारण हो रहा है तो ड्राइनेस, क्रैकिंग इस प्रकार से दिखता है। और प्राइमरी दोष जो है इसमें हम रक्त धातु इसमें मेनली दूषित होती है, जो त्वचा और लसिका मतलब लिम्फ नोड्स को भी, लिम्फेटिक सिस्टम को भी दूषित करती है। लक्षण सिम्टम्स में पर्टिकुलरली दिखते हैं कि कंडू, इचिंग, रेडनेस, पीड़िका, स्त्राव मतलब ओजिंग, शाव, अरुण वर्ण, दाह और रुक्षता, ड्राइनेस सिस्टम सिम्टम्स में दिखते हैं। तो चिकित्सा हम देते हैं, पर्टिकुलरली आयुर्वेदा में चिकित्सा सिद्धांत है कि निदान परिवर्जन, संशोधन चिकित्सा और संशमन चिकित्सा। निदान परिवर्जन मतलब कि जिस कारणों से उसको ये विकार उत्पन्न हुआ है तो उसको अवॉइड करना, अवॉइड कांटेक्ट विथ पॉजिटिव सब्सटेंसेस, और उसके लिए बैरियर, ग्लोव्स और प्रोटेक्टिव मेजर्स को लेना है। और शोधन चिकित्सा आयुर्वेदा की बेस्ट चिकित्सा है कि डिटॉक्सिफिकेशन जिसको हम बोल सकते हैं, इसके लिए हम विरेचन देते हैं एनिमा से, या परगेशन देते हैं, या पित्त रक्त जो दुष्ट हुआ है उसको शरीर से बाहर निकालता है। रक्त मोक्षण चिकित्सा हमारे इसमें है, तो रक्त मोक्षण चिकित्सा जलों का हम देते हैं, पेशेंट को जलों का लगाते हैं, या सिरावेद मतलब नीडल से जो वहां का दूषित रक्त जो है वो निकाल लेते हैं, एक्सेसिव दूषित रक्त जो है निकाल लेते हैं रक्त मोक्षण से। और वमन इमेसिस, कफ डोमिनेंट जो भी स्किन डिसीजेस है, जैसे अभी वासंतिक वमन, आयुर्वेदा की स्पेशलिटी अभी वासंतिक वमन चल रहा है कि जिनको कफ क्लेशित होने से जो डिसीजेस हो रहे हैं, तो उनका संशोधन करने के लिए बात जो है वो संशमन चिकित्सा है। संशमन चिकित्सा मतलब कि उसके लिए हम आयुर्वेदिक हर्ब्स यूज करते हैं, तो बेस्ट आयुर्वेदिक हर्ब इसके लिए बताया गया है गुड़ुची, उसके बाद हरिद्रा, मुलेठी और विडंग। विडंग जो है वो वर्म इन्फेस्टेशन के लिए भी रहता है। तो ये बेस्ट हर्ब्स हमारे आयुर्वेदा में स्किन डिसीज के लिए बताए गए हैं। उसके बाद कॉमनली यूज्ड आयुर्वेदा मेडिसिन से पंचतत्व तिक्त घृत महामंजिष्ठादि काढ़ा खदिरारिष्ट गंधक रसायन आरोग्यवर्धिनी वटी निम्बादि चूर्ण। इसी प्रकार से ट्रीटमेंट हमने पेशेंट को दी थी कि निदान परिवर्जन उनको बोला था कि जब भी आप मतलब वहां फैक्ट्री में काम करेंगे तो आपको ग्लोव यूज करना है। उसके बाद जो है वो उनको जलों का चरण मतलब हमने जलों का लगाई थी, रक्त मोक्षण किया था उनका। संशोधन में हमने उनको पर्गेशन विरेचन चिकित्सा दी थी और संशमन चिकित्सा में हमने उनको पंचतत्व घृत महामंजिष्ठ आदि काढ़ा खदिरारिष्ट गंधक रसायन आरोग्यवर्धिनी वटी और निम्बादि चूर्ण इस प्रकार की ट्रीटमेंट दी थी। और पथ्य में लाइट और इजीली डाइजेस्टेबल फूड देना है, यही हमने पेशेंट को दिया था। बिटर वेजिटेबल्स नीम पर्टोल और मेथी का यूज किया और प्लेंटी ऑफ वाटर्स उनको लेना है। और अवॉइड क्या करना है कि कर्ड फिश प्लस मीट स्पाइसी और ऑयली फूड जो है वो अवॉइड करना है। अवॉइड एक्सेसिव सन एक्सपोजर, ये सब पेशेंट को बताया गया था। तो कंक्लूजन में ये है कि अकॉर्डिंग टू आयुर्वेदा डर्माटाइटिस इज मेनली अ पित्त कफ डोमिनेंट त्वक रोग इन्वॉल्विंग रक्त दुष्टि। मैनेजमेंट फोकसेस ऑन बैलेंसिंग दोषास, purifying blood, improving digestion, and following proper diet and lifestyle. Thank you so much.
Thank you, Dr. Mamta. You have presented your presentation in a very sweet manner, and so all aspects are covered. That the etiology, then investigations, and then treatment. And but I want to discuss about limitation according to Ayurveda.
What, ma'am?
In which condition you are going to refer your case?
Varicose veins.
Okay, for varicose vein, you will prefer to.
हाँ.
Okay. Thank you.
Varicose vein, yes, ma'am. For varicose veins, we refer to काय चिकित्सा डिपार्टमेंट, मैम.
Okay.
स्टॉकिंग यूज कर ही रहते पेशेंट स्टॉकिंग यूज कर ही रहा था। इसकी ट्रीटमेंट हमने मेडिसिन रेफर मेडिसिन डिपार्टमेंट।
Okay, medicine or surgery you may prefer.
For varicose veins.
Okay.
We treat dermatitis, only dermatitis.
Okay.
In our OPD, ma'am.
Thank you so much.
Because we have our skin diseases OPD.
Yeah.
Okay.
So now the next discussion is from homeopath, and Dr. Ajay is also there. So we will discuss first as per dermatology. So Dr. Ajay sir, you may share your screen now.
Yes, ma'am. So my screen is visible, ma'am.
Yes, sir.
So thank you for inviting me as an expert for this session. Purpose of today's presentation is not telling detail about this contact dermatitis, but purpose is to give some inputs as this student has presented this case very well, and I wanted to give insights regarding how to approach a case in view of diagnosis and management. So starting with the topic, whatever things are going on our body and in the environment, so these things are reflected on the skin. So I am calling it as a witness. So our skin is a witness, not only the largest organ of the body, but it is the witness. And whatever changes we are observing on the skin, we should develop a clinical detective approach to find out what is going on in our body. So, starting with irritant contact dermatitis. In the present case, we are having suspect number 1, as we are labeling this case as contact dermatitis, which has 2 types, like irritant contact dermatitis is most commonly presented in these patients. And what happens in irritant contact dermatitis is direct toxic effect to the skin. Here, immunity is not involved. The substances like various acids, alkalis, solvents, soaps. For example, some acid is it spills on our skin gets burnt, or some toxic chemical comes in contact with our body, the skin gets irritated. So this is type of irritant contact dermatitis. So it presents in the form of direct toxic effect. Here we should remember that it is non-immunologic and it happens immediately in minutes to hours, and it is characterized by burning or stinging. Here in allergic contact dermatitis, only 20% cases are there, and this allergic contact dermatitis is characterized by immune mediated mechanism. Here type 4 T cell mediated hypersensitivity is responsible for causing this allergic contact dermatitis. So what happens many times when we go for any trip on the beach? So there we get exposed to the sun, and immediately nothing happens. But say after 2 days, we experience some rash over our body. So we are unaware that this allergic contact dermatitis it presents silently after 2 to 3 days, and it is characterized by intense itching and some environmental triggers like nickel, even fragrance. We use perfumes these days. As a doctor, we have contact with rubber gloves. So these are the sensitizers. So this is about irritant contact dermatitis and allergic contact dermatitis. Now, in our day-to-day life, we have various metals like artificial jewelry contains nickel. So there is a simple test called dimethyl glycozyme test where we put this chemical on cotton swab, and if we want to detect whether this jewelry has this nickel, when we rub this cotton swab with the article, if it turns pink, then we can detect that it has nickel in it. So nickel allergy is very common in our patients. See, we advise rubber gloves for many patients to avoid contact to prevent this contact dermatitis. But rather contradictory, this rubber itself contains various like carbamix thiorams. So we have to prefer these nitrile gloves in case of these allergic patients. And there are many hidden chemicals. Even some products may label as unscented. So unscented doesn't mean fragrance free. Unscented means the scent, whatever that chemical has, it has been unmasked by other chemicals. So we should search for these fragrance free medications. Many of the creams, even the creams which we use for treatment, they may contain formaldehyde as a preservative. So we have to look for these responsible chemicals which may be responsible for causing this contact dermatitis. Coming to this case, the 50 years old male who works in plastic manufacturing factory presented with this bluish brown discoloration over left lower limb, presented with intense itching, dryness, worsens with standing, and patient has history of varicose veins for 2 years. While asking question, you rightly pointed out this factor of varicose veins, and one complication or one additional thing is that co-workers report similar rashes. So when these co-workers are reporting similar rashes, whether we should label it directly as contact dermatitis because other workers in factory are getting similar rashes. So let us look. So after examination, what evidence we are finding? Here, the vascular clues like there are prominent tortuous veins, medial aspect distribution, that is distribution or greater zone, and there is bluish brown hemosiderin pigment. You can observe here, and there are signs of dermatitis in the form of dry lichenified. Lichenified means what? Skin becomes here thickened and hyperpigmented. That we call lichenification. But there are no active vesicles or there is oozing. So morphology suggests chronic eczema superimposed on a vascular issue rather than acute allergy. So means there is no acute allergy because there are no vesicles, there is no erythema, there is no swelling, and there is no oozing. So first is there is no irritant contact dermatitis, but there are changes of this vascular involvement because patient has varicose veins, the veins are dilated, and there are some eczematous changes. So to be more clear here you can see vascular prominent tortuous veins on medial aspect, and we need to observe this bluish brown hyperpigmentation I earlier mentioned. So this bluish and brown pigmentation is characteristic of hemosiderin. So this is not due to lichenification. What happens when patient has these tortuous blood vessels, dilated blood vessels, the patient system, whatever blood is coming to his legs, that patient's body is unable to send that blood backwards. So this blood gets deposited in this lower part of the leg. What happens? The RBCs, they ooze out of the blood vessels, and RBCs means red blood cells, and they turn in form of hemosiderin. So hemosiderin is giving this brownish and bluish color. So this pigmentation is due to this vascular part, and skin appears dry and mildly thickened. It is due to lichenification. So negative findings, we cannot call it only the vascular factor because there is no active ulceration, oozing, or frank vesiculation. So morphology suggests that there is chronic dermatitis rather than acute flare. So here we suspected irritant contact dermatitis. So because there is occupational exposure, but pigmentation suggests that that is due to chronicity of this vascular component or uh, dilated blood vessels. If we suspect allergic contact dermatitis, why? Because there is itching and co-workers are also suffering from the same cause. But what happens if we want to confirm this allergic contact dermatitis? We require additional proof in the form of patch test, which will confirm the diagnosis of the causative allergen. So that is very important. Unless and until we find out the causative allergen, we cannot label it allergic contact dermatitis. Till then, we can just say it occupational dermatitis. And stasis dermatitis, the varicose veins are present, but varicose veins etiology does not explain the factory cluster. So what happens next? So my expert opinion regarding this case is we have to reverse the etiology. So it is not case of contact dermatitis along with varicose veins, but the varicose veins and then there is over added contact dermatitis. So diagnosis reverses the hierarchy of pathology. The primary pathology is vascular. So pigmentation fits venous stasis because of hemosiderin deposition and not allergy. Localization is on the medial aspect of leg, which is classical of stasis dermatitis, and absence of vesicles make acute allergic contact dermatitis unlikely. But additionally, we have there is input for student that when there are varicose veins, we should ask patient for Doppler study so that we can assess the venous reflux. So that is important thing which is missing. So in conclusion, I want to propose a double hit etiology. Like first, patient is getting stasis dermatitis because of chronic venous insufficiency. There is compromise in the barrier. Why? Because there is improper blood circulation in his lower limbs, which causes edema and hypoxia. So, as blood flow is not proper, the superficial parts like skin is not getting proper oxygenation. So, what happens? The oxygen is not proper, skin nourishment is not proper, so it causes dryness, and dryness it affects the barrier of the skin, and the barrier of skin, if it is damaged, it allows more and more allergens uh, entry into the skin. So this is first factor. And occupation irritants like resins or plastics, they are penetrating weakened barrier from outside. So I would put diagnosis of stasis dermatitis with secondary occupational overlay. So how can we approach? So these are few points regarding the patch test. So patch test, how it is performed? So there are different allergens. Allergens like what names I earlier mentioned, like nickel, then chromium, then parthenium. So there are a lot of antigens. Here you can see around 60 antigens are placed on back of this patient. What is done? So here you can see this circular dish-like substance. It is called aluminum chamber, or it is called pinch chamber. So this pinch chamber, in that minute concentration of that allergen is uh, put on this chamber, and then it is fixed on the back with the help of sticking. We have to leave this chamber on patient's back for around 2 days. So final reading is taken after 48 hours, and then repeat readings are taken at 72 and 96 hours. Why these late readings are taken? Because as we have earlier seen, allergic contact dermatitis, it is slowly manifesting disease because it is immune mediated. So the manifestation is after 72 hours. So that's why we have to take reading after 72 hours. And when the disease is active, we cannot do the patch testing because the immunity is already hypersensitive. If we again put these many antigens on the back, so whole back will become angry. So that is called angry back syndrome, and it may also cause flare of the disease. So now coming to management, first one is, so consider if we have gun and we are keeping on pulling the trigger. So the allergen, it works as a trigger. So first we have to identify the allergen by doing the patch test and eliminate the allergen at the start of treatment, because unless we stop the trigger, it will not, gun will not stop firing. Then we have to modify workplace. As in the given case, we have to maintain the ventilation, or we have to automate the chemical handling. We should the worker should have least contact with the chemicals, and we should give protective devices in these occupational settings like nitrile gloves, and barrier creams are secondary, but first we should provide nitrile gloves. In management, there is medical ladder, where we all know to repair the skin barrier we should use these emollients in large amount, because these emollients will protect our skin and it will repair the barrier which will prevent the allergens entry into the skin. So emollients means the moisturizers, body lotions, uh, the paraffin, whatever oils we are using, we call it emollients. And how to apply it? We have to apply these emollients on moist skin. Why moist skin? When we apply it on moist skin, the emollients will lock the moisture in the skin. It will help the skin stay moist for longer time. And then layer controls, we can use topical steroids, clobetasol. Topical creams we have to use. But we have here caution that if we are prescribing this topical steroid cream to the patient may keep it on using for a long time. And if these creams are used for long time, the steroid can cause atrophy of the skin. So these steroid creams, these are used only for control of the flare. That is for around 5 to 7 days. And now the newer drugs which are there in the basket, like tacrolimus, pimecrolimus, which are also called steroid sparing drugs. These are used for long-term maintenance. They are they can be used for long term because they do not cause thinning of the skin or atrophy of the skin as caused with steroids. And of course, the management of varicose veins by using compression therapy, by using stockings, by changing lifestyle, like the patient should not stand for long. We can alter his job and he can take rest after every 45 minutes, or after doing Doppler studies, he can go for laser correction or repairing of the walls. So reducing edema improves oxygenation and barrier function. So treating this contact dermatitis along with this basic cleanup pattern, that will give patient long-term relief. Similar cases are other occupational dermatitis like chloracne, where these are not true acne, but when some workers uh, in some oil industries, like even edible oils or uh, mechanics, they come with these halogenited hydrocarbon, or they are also called dioxins. They may present in form of comedones or cysts, which are typical sign is that these comedones or cysts, they spare nose. So these are called chloracne. There is also fiberglass dermatitis, where we can diagnose this uh, glass fibers if we put a tape on skin and we remove that tape. We can see these glass fibers, they are attaching to the tape. And contact urticaria, it is a type 1 hypersensitivity. It may be immediate in presentation when there is contact with latex or some type of foods. Now, when to call for backup or when to refer? So, hand dermatitis, which is not improving after a lot of treatments, lot of emollients, various topical steroids. Here, I want to tell that unless and until we are confident about use and how to use which steroids at which site, because require different steroids, potent steroids, our body requires different. The his face, eyelids, even different ages like old age, the childhood, there are different requirements of steroids. So we should not indiscriminately prescribe these steroids, because there is also trend of inadvertently using this steroid as a fair cream. That should also be discouraged. And then if there are persistent recurrent rashes over face, so that should be referred for detecting these allergens. Of course, the refractory cases which are not responding to standard therapy, and some occupations like factory workers, even our healthcare workers, they have to use various chemicals. They come in contact with uh, antiseptics, And then some professional like hairdressers, they also come in various chemicals like hair dyes. So they also can be referred. What are the red flags for immediate vascular infection referral? If there is ulceration or lipodermatosclerosis. Lipodermatosclerosis means it is next stage of this varicose stasis eczema. The stasis eczema is also called gravitational eczema because due to gravity the fluid accumulates in lower limbs. So lipodermatosclerosis causes thickening of the skin. There may be ulceration. There may be atrophy blanch. So at that time, this patient can be referred, or there may be crusting or rapid progression of the signs. So the takeaways: skin is a witness. We have to look for various signs which whatever the skin is presenting to us, and we have to look for the comorbidities. So look for comorbidities, then respect the hierarchy. So if the vein is first or the allergen, to verify the primary driver, because treating primary driver is very important. In this case, the varicose veins, and follow the rules like patch test only when skin is calm, and we have to read after 48 hours, and treat the root. Pincer movement required, block the irritant, and support the veins. Thank you.
Thank you so much, sir, for your detailed presentation on etiopathogenesis, then how to diagnose whether it is vascular or dermatological, or whether it is allergent, or it is from occupational cause. So, and then investigations and treatment, line of treatment and limitations. So again, you have discussed this case from all the aspects. Thank you so much, sir. But there is one limitation I can saw you on slide. That is steroid. Use of steroidal patches or ointments is one of the limitation. So I want remedy or alternative for these steroids from Unani, Ayurveda, and homeopath. So we will discuss on it. Now we will discuss homeopathic approach for this case. Dr. Meeta Gharte. Dr. Meeta Gharte, are you there?
Yes, ma'am. Yes, ma'am, I'm there.
So, ma'am is vice principal from Motiwala Homeopathic Medical College, Nashik. So, what about homeopath, ma'am?
Yes, ma'am. Ma'am, has my video been switched off?
No, ma'am, you are not visible. So, I will again request to Dr. Ajay, please. You may stop your screen sharing.
Can you stop from your side?
Okay, आपलं computer department. Computer department. कोणी आहे का मदतीला? धेंडे सर. हे अजय सरांची स्क्रीन बंद करायची आहे आणि मीता मॅडमची स्क्रीन सुरू करायची आहे. आम्हाला प्लीज मदत करा. कम्प्युटर डिपार्टमेंट, MUHS कम्प्युटर डिपार्टमेंट. मीता मॅडम, स्टार्ट व्हिडिओ. मीता
Off
मॅम,
झाले
यू आर
वाटतं मॅडम.
Hello, ma'am.
host. Yeah, you may start.
Still, I think I'm not able to start the video. Can I directly share my screen?
Yeah, ma'am, please.
Okay. Is my screen visible, ma'am?
Yes, ma'am. It is starting.
Okay, first of all, thank you so much, Gitanjali ma'am, for inviting me as an expert. And thank you to Ayush department also.
It's our pleasure, ma'am.
Uh, so we are,
Fourth thing from for audience, Dr. Meeta is head of dermatology department from Motiwala Homeopathic Medical College.
sorry ma'am, I'm head of pediatric department, but I also see dermatological cases. That is why I'm here.
Okay, so she is having huge experience to handle such kind of cases, and that's why we have invited her to discuss this dermatological case. Yeah.
Yes ma'am, thank you so much. So we are discussing a case of occupational allergic contact dermatitis, and I'll directly go to the homeopathic understanding of this case, ma'am.
Ma'am, please double click on your uh, yeah.
One sec, ma'am. Is my screen visible now?
Yeah, but it is not started. It is starting.
Uh, is this case overview slide visible, ma'am?
No, no, not yet.
I'll take a second, ma'am. Ma'am, is there any problem from your side? Can you please see?
Okay, let me check. No, ma'am, you are co-host and you may share directly. We have allowed screen sharing for you. कम्प्युटर डिपार्टमेंट त्यांना काही मदत करता येते का बघा. डॉक्टर मीता मॅम त्यांना स्क्रीन शेअरिंग करायचंय.
Because it on my screen it shows that I'm sharing.
सो मॅम काय करा, तुम्ही बाहेर पडा त्यातनं आणि परत
Okay.
एकदा शेअर करा.
Okay, ma'am.
आणि आधी काय करा, शेअर करायच्या आधी तुमच्या स्क्रीनवरती ती स्क्रीन चालू ठेवा आणि मग शेअर करा. ओके.
Yes, ma'am.
Double click to enter full screen mode. Double click.
Camera enabled devices settings devices to check whether it is enabled or not.
डबल क्लिक करा एकदा मॅम.
एक second, ma'am. Our technician is seeing what's the difficulty.
मग
Basically,
तोपर्यंत
I'm not able to. हाँ चालेल मॅम, तोपर्यंत तुम्ही नेक्स्ट स्पीकर घ्या.
आणि युनानी आपण एक्सपर्ट ओपिनियन घेऊयात. ओके, सो वी हॅव टुडे इज युनानी डे अँड वी हॅव युनानी एक्सपर्ट डॉक्टर खान झकीर अली. He is assistant professor from Department of Medicine,
Connected
JDH
devices
Unani Medical College and Hospital, Pune. So welcome, sir.
Good evening to Gitanjali
the
Madam
settings
and
button.
all the members from MEHS. And I am thankful to all the organizer of MEHS that on this very auspicious day you have organized the event, and also you have chosen a very important topic like contact dermatitis, which is like It is not, we can't say it is life threatening, but it is very important. People like patients are getting fed up with this disease, and in modern, like they are giving lot of steroid, and patient is still they complain that recurrency. So the topic is very good, and the day is very like auspicious for we people like Unani. So I'm very thankful to the MUHS and the organizer of MUHS.
Thank you
And
so much, sir, for joining. Yeah.
madam, please allow me, like Khan Zakir Ali. I joined with my mobile as well as my laptop. So I will share my PPT through laptop.
कम्प्युटर डिपार्टमेंट त्यांचा जो दुसरा नंबर आहे त्याला पण अलाउ करा, दुसऱ्या नंबरलाही को-होस्ट करा. Sir, on which name you have joined?
Khan Zakir Ali.
Khan Zakir Ali. Okay. सापडलंय का कम्प्युटर डिपार्टमेंट? सापडलंय तुम्हाला सरांचं नाव? सर करून एकदा प्लीज ट्राय.
Is it visible, my slides, madam?
Yes, sir.
Okay. So basically it is not slide, it is a document, PDF form. I have converted it. See, I have divided into 4 parts, like as per the guideline of MUHS. Number one, the underlying etiology, like which we say in Unani asbabe marz, like the causes of the disease. So from an Unani viewpoint, contact dermatitis can be correlated with vermegil. Like we in Unani we say vermegil or inflammation of the skin or hasasiyate jild, like cutaneous hypersensitivity. Asbab, if we see causes, so it can be a direct cause, which is like same as modern and Ayurveda, like contact with chemical irritant like acid, alkali, detergent, cosmetic. Metal may the nickel is very common, chromium, artificial jewelry, and patients like come to our clinic like after wearing some gold and some metals like as a jewelry. Plants sometimes like they have patients have a history of traveling to some like a garden or like they touch some plants leaf and they got irritations and then develop a contact dermatitis. So even occupational exposure like cement, dyes, leather, rubbers, and drugs. Some drugs, if the patient comes to us with application of certain drugs, like after applying certain drugs they develop a contact dermatitis. And then the second cause is like asbabe munfaila, which we can say predisposing causes. In Unani we say sue mezas, like derangement of the temperament, especially in Unani Damvi and Safravi temperament, like if there is problem in the Damvi and Safravi or derangement of these two temperament can lead to the contact dermatitis, and the symptoms of these two temperament are very severe, like they're developing erythema, burning sensation, and like in Safravi there will be a severe inflammation and itching. And also the one of the most common predisposing factors are weak quote mudabbire badan, like defective power, and sometimes excessive hararat, like excessive heat and dryness. So these are the common predisposing causes in Unani. And accumulation of morbid matter, like when there is excessive sweating and wet, that also lead to the contact dermatitis. And also allergic diathesis is lead to the contact dermatitis. And now we'll discuss the pathogenesis. According to the Unani concept, external irritant, any external irritant which we have mentioned will lead to the altered local temperament and that will produce imtilaidam, like congestion on the skin, and that congestion will lead to the increase in the temperature or hararat. We can say in Unani hararat, there will be an increase in the temperature, and then that will lead to the inflammation, that will lead to the itching, development of vesicle and the scaling. And what are diagnostics? The first point I have covered, that was etiology and pathogenesis. Second topic, like a point, diagnostic method are as per the Unani therapy, that we can say tashkhish. Diagnostic in Unani medicine is based on the clinical observation plus temperament based plus case identifications. So clinical examinations like Moine Maris, whoever patient comes to our clinic, we just examine, that is called Moine Maris, and that will be a surkhi means redness, which we say in modern redness, itching means hicca and vesicle development of abla, burning sensations, oozing or dryness, distribution limited to the contact area. So basically these are the approaches by which we can approach. It may be a contact dermatitis. And then history, like tarikh mars, we have to take detailed history of exposure to new cosmetic or metal or chemical plants. Also we have to take detailed history of occupational history, previous allergic episode, like in past if they have any history. Then seasonal aggravation, like most of the time the patient comes to us that we have the similar problem in winter season, or like when we travel in a cold atmosphere. And misas, ultimately as a Unani physician, we assess the temperament, basically Damvi temperament and Safravi temperament, the symptoms will be more, and while in case of Saudavi the symptoms will be low. And massage assessment, like if the in Unani concept there are derangement of the four health, like temperament. Damvi, in Damvi we will have a symptom of erythematous, warm lesions, while in case of Safravi temperament we will have a burning sensation, more intense symptoms in case of Safravi temperament. Yellowish discharge will be there from the skin, and in case of Balgami, the mild, there will be a itching will be mild, and the lesion will be whitish, while in case of Savdavi, it will be a chronic and skin will be very thick. So by this way we differentiate that what health or what humor is responsible, like derangement of what humor is responsible for developing contact dermatitis. So accordingly we have to manage it, like if it is Damvi, we have to treat like Damvi. If it is Safravi, we have to treat at the principle of Safrag. And then modern supportive tools, already sir had discussed very in a very precise and good manner. Then a line of treatment, wasule ilaj, as per the Unani concept, treatment follows ilaj bil sabab, like we have to treat the cause, we have to remove the cause. Then ilaj with tadbir, ilaj with dawa, like by some measurement, and ilaj with dawa, like by some treatment, medicine, herbal medicine. And then ilaj bil giza, by avoiding some diet and by providing some diet, like. So first we'll discuss treatment, line of treatment. First we'll discuss ilaj bil sabab. We have to remove the cause, like identifying the and avoid the allergen, whatever allergy. And remember, like if the like sometimes the poor patient comes to us and they have a occupation of like doing in some chemical industry, so we can't avoid them and we can't say them that you now stop the job. We can ask them to follow some prevention, like you wear a gloves or wear a some or follow some measurement that you can avoid to getting in contact of that irritant chemicals. Use protective gloves, barrier, stop offering cosmetic chemicals, that way to advise. Then ilaj with tadbir, like regimen therapy, by like doing some measurement, that in Inani we say a tankiye badan, like detoxification. If there is a humor getting, like most of the time when we take history, like we took history in OPD, patient comes to us with history of indigestions, gases, flatulence, and most of the time the patient will, like these patient will have a more skin problem, especially the contact dermatitis. So we have to correct their digestive system. Our Unani system like encourages us to always to detoxify the matter which is there in the body and to correct the digestive system so that the disease will get cured. And then facet venesection, like we have to remove the waste material through doing a venesections of the affected limb or affected part of the body, and then by doing hijama like cupping for a chronic inflammatory tendency. And then absan, this is very fantastic way to treat the patient of dermatitis, like the patient is having dermatitis of whole body or the maximum area of the body is getting like infected. Then you can use like a tub bath which will have a neem leaves decoctions, or you can use babul bark, or you can use a gulab water. You just mix it in a tub of water and ask the patient to take a bath. So it is very effective. It keeps the skin moist and soothing, and it will definitely, you will have, it is a like anti-irritant also. Then ilaj with dawa, pharmacotherapy. In Unani medicine, we use like in OPD, we use in the form of application, in the form of syrup, decoction, or in the form of like some compounds. So local applications, for local application, we use in OPD like Rogane Gul, that is rose oil, Rogane Neem, Marhame Kafur, and then marhame dakhlun or aloe vera, that is sibr zard, we say it in Unani preparations, or sandalwood paste for cooling. So it is very effective. We are using in our Unani OPD and we are getting a good result. Then internal medicine we can use, or we can recommend the patients like sharbate unnab. This is very good medicine. It keeps the blood like it purifies the blood, and it is like it prevents the itching also. Then Sharbate Banafsha also, it is the blood purifier. Majune Ushba, we use it as a blood purifier. Arke Neem also we use it. And Arke Murakkab Musaffi Khun, which is very good, which is helpful in all the type of contact dermatitis. Then Habbe Musaffi Khun also we use it. And for itching especially we use Kuste Gandhak, that is purified sulfur preparation, which we have, it is available in our chemist shop. Kurse Musaffi Khun also we can use in Unani. And then Ilaj bil Giza, this is the most important part in Unani. Like we have to advise all the patients like diet to be avoided, जिसको हम परहेज बोलते हैं. So that will be a spicy. Patient has to avoid spicy, fried, sour food, and seafood also he has to avoid. He has to avoid excess salts and pickle. This is the most important part. Basically, we prescribe the medicine, but we don't give the advice what to take, what not to take. So this is the most important part. And then again, diet to be recommended, like cooling diet, cucumber, bottle gourd, pomegranate, and green leafy vegetable. We have to ask the patient to avoid non-veg. It is also not good for the skin problems. And then the fourth point which I need to discuss, limitation. Like we refer the patient to a specialist when there is severe acute allergic reactions, angioedema, anaphylactic reactions, extensive blistering dermatitis, also secondary bacterial infection with pus and fever, occupational dermatitis requiring patch testing, chronic cases not responding to 2 to 3. Whatever cases, if it is not responding to Unani medicine for 2 to 3 weeks, we just refer to the dermatologist or another unit. When to refer a dermatologist, like diagnostic uncertain, when there is like we are doubt that it is psoriasis or fungal infection or SLE or contact dermatitis. When we are confused, we send the patient for proper diagnosis. And then also we send the patient of cases of severe eczema requiring steroid, immunotherapy. Also we send the patient like systemic symptoms like fever, malaise, if it is associated with contact dermatitis. Pediatric severe dermatitis also we refer to the pediatrician or we refer to the dermatologist. Suspected malignancy or pre-malignant lesion, if you are suspecting, then also we refer to the patients to a specialist. And now we'll discuss integrated approach recommended, like Unani treatment can be continued as a adjuvant or adjuvant therapy with modern dermatological care for faster recovery and prevention of recurrence. Also, I will discuss one more new development in Unani system of medicine for treating contact dermatitis is Irsale Alag. in Unani we use leech, that is we say irsale alak yani leech yani chonk lagana. Basically we apply it on affected area. These it has a very good result, and also we have published many paper on irsale alak like leech therapy, which is very useful for treating contact dermatitis. And then conclusion, contact dermatitis is primarily a disorder of altered temperament or hypersensitivity of skin triggered by external irritant. Management focus on elimination of causes, corrections of temperament or misas, detoxification of blood, and local soothing therapy with timely referral to the severe and resistant cases. Thank you very much, madam.
Yeah, thank you so much, sir. So, on the occasion of World Unani Day, our best wishes are with you.
Thank
And
you, madam.
thank you so much for such a wonderful explanation. And I can notice one thing that the basic concepts of Ayurveda and Unani are little bit similar. And the line of treatment is also similar. So, there is also bloodletting in Ayurveda, Raktamokshan in the Mamta man's slides, and in your slides there is bloodletting with leech. So there are similarities in the basic concepts of both therapies. Thank you so much, sir. Now I will call Dr. Meeta Gharte, ma'am. I will share your screen. Yeah, is it visible? Is it visible to all? Dr.
Yes,
Meeta?
ma'am, it is visible.
Yeah. So, Meeta ma'am, you may start your expert opinion on homeopath. कम्प्युटर सेक्शन मीता मॅमला अनम्यूट करा. को-होस्ट आहेत त्या ऑलरेडी, त्यांना अनम्यूट करा. त्यांची स्क्रीन मी शेअर केली आहे. येस.
Good afternoon, ma'am, and sorry for inconvenience.
No ma'am, no problem at all. So,
Ma'am, if you can come to the first slide, case overview.
case overview. Yeah.
So we are dealing, am I audible?
Yes ma'am, you're audible.
Okay. So we are dealing with a 50-year-old male patient who is suffering from occupational allergic contact dermatitis. Next slide, please. According to homeopathic understanding of this case, the important points are that the disease has occurred because of prolonged standing and chemical exposure. He's working in a plastic factory, so heat exposure could be additional factor. Here, seat of disease is venous system. Along with venous, pathology is venous stasis. If it was, voice is breaking.
Yeah.
Here pathology is venous stasis. Now, would had been only a prolonged standing and exposure that would have caused venous stasis and led to varicose vein, then I would have considered this case, according to homeopathy, as artificial chronic disease. But again, there is a component of hypersensitivity over here. That means there is an immune-mediated reaction. This makes this stasis, since there is hyperpigmentation, the miasm that is being in true chronic disease, we consider that it is miasm that actually causes the disease to occur. In this case, the miasm that has caused disease to occur, as we consider, is a psychotic miasm in addition to psoric miasm. Stasis, laxity, and hyperpigmentation all will point towards psychotic miasm, whereas hyperpigmentation, dryness, and itching will point towards psoric miasm.
So basically, I understand that we are dealing with the sauropsychotic case of dermatitis, which is being caused due to varicose veins. Here, only the left side or left extremity is more involved. I think right extremity has varicose vein, but dermatitis is seen in only left side. So I consider it as an individualizing symptom of this case. Homeopathic approach to this case. First of all, to make a homeopathic prescription over here, the most important point for me would be to take a detailed history taking, because we consider a patient who has been diseased and not the disease itself. So little case taking, details of case taking should involve in this case. What was the mental general state of the patient? What are his expressions to the disease? What are the changes in his will, intellect, and emotion after the disease has occurred? I would also like to know that what are the changes that have taken place on the general level? Is his appetite normal? Is his bladder habit normal? What is his thermal reaction? Is his sleep pattern normal? So all this would have helped me in making a proper prescription. So for homeopathic approach, first, ma'am, can you please come to the next slide? Been beneficial over here. After a detailed case taking, I would have taken the individual symptoms of the case and I would have selected a constitutional remedy which would have been anti-miasmatic in nature.
So which slide?
Only remedy would not help.
Therapy.
I want therapeutic strategy here. Only homeopathic remedy would not have helped over here. So supportive lifestyle was also important. Therapeutic strategy here would have been selecting a constitutional remedy based on totality of symptom, which would be a mainstay of the treatment. I may require intercurrent remedies because I'm considering that this is a case of SORA plus psychosis. Psychosis is a stubborn miasm, and hence psychosis may require some intercurrent doses of anti-miasmatic remedy. So as the case proceeds, I would have thought of it. Very important, as we said, the maintaining cost should be removed. That is a long-standing or heat exposure or chemical exposure. If it goes on happening, and if I give my remedy may not show so much benefit, and that is why avoiding occupational allergens, or at least taking some protective measures is very important. Again, venous stasis has to be dealt with. This can be by integrating my treatment with physiotherapy treatment, giving some exercises, giving leg elevation, decompression treatment, as well as for a very long time. So this would have been. Next slide, please. My consideration of selecting the remedy here would be ailments from prolonged standing, ailments from heat and chemical exposure. Complaints are left-sided. There is venous stasis. Due to hemosiderin deposition, there is bluish discoloration, and miasm is sauropsychotic. Taking all this into consideration, I have come to some group of remedies which can suit this case. Next slide, please. Some of the important remedies that I would consider over here are lachesis. Lachesis is actually a snake remedy which is prepared from the poison of surukuku snake. And the main symptoms of lachesis are that there is venous involvement, there is stasis, there is bluish discoloration. Complaints are left-sided. So I would have definitely thought about lachesis as a remedy in this case if mental general symptoms and physical general symptoms would have matched lachesis. Another very important remedy that I would have thought in this case would have been sepia. Sepia is a wonderful remedy for venous stasis plus hyperpigmentation. Especially, it is also a left-sided remedy, and prolonged standing or overworking could be a cause in sepia. So I would have thought of sepia in this case if once again mental general and physical general symptoms matched. Graphitis, hemamelis. Hemamelis is a beautiful homeopathic remedies that is used for varicose veins and complications that are caused due to varicose veins like stasis, dermatitis, or ulceration. So in this case, I would have also thought about uh, uh,
Ma'am, you are not audible.
Rita ma'am. Meeta ma'am. You are not audible, ma'am.
hello, am I audible, ma'am? There's
Yes.
lot of technical difficulty today. Today is not my day, ma'am.
You are audible.
So these are certain remedies that I would have thought about. Now coming.
Again, your voice gone, ma'am. कम्प्युटर सेक्शन आपण काही करतोय का त्यांना म्यूट वगैरे मीता मॅमला अनम्यूट ठेवा त्यांचे दोन्ही पण डिव्हाइस अनम्यूट ठेवा प्लीज नो मॅम युअर व्हॉइस इज नॉट रिटन सो
Okay, ma'am. I'm extremely sorry for inconvenience.
no problem ma'am but we will stop here and again we will discuss the same matter on homeopathic backgrounds. So we will stop here and thank you so much to all our experts. Thanks to Mansi, thanks to Dr. Ajay, thanks to Dr. Mamta, Dr. Meeta, Dr. Khan Zakir sir. Thank you so much to audience. Let's stop here. Yeah.